Hello, good afternoon, class. Welcome again to another pre-recorded lecture. Today we'll be discussing depressive disorders, and you might be wondering what are those disorders. So I'll be sharing with you the different types of depressive disorders. And so depressive disorders are characterized by the presence of sad, empty, or irritable mood, accompanied by somatic and cognitive changes that significantly affect the individual's capacity to function according to the Diagnostic and Statistical Manual of Mental Disorders. So again, they are characterized by sad, empty, or irritable mood, accompanied by somatic and cognitive changes that significantly affect the individual's capacity to function. And so again, these depressive disorders, they significantly affect functioning of an individual. And to be diagnosed with, depression, as we know, the symptoms must be present for at least 2 weeks. But depressive disorders are more than just depression or major depressive disorder or clinical depression, but we'll talk about some other types. Types of depressive disorders. So we have what we call disruptive mood dysregulation disorder, which refers to the presentation of children with persistent irritability and frequent episodes of extreme behavioral dyscontrol. And so again, disruptive mood dysregulation disorder, that disorder is present in children. And it is present in children up to 12 years of age. Again, disruptive mood dysregulation disorders only present in children. Next one is major depressive disorder, also called depression or clinical depression, and also called major depressive episode. Persistent depressive disorder, also called dysthymia, a more chronic form of depression or major depressive disorder. It is diagnosed when the mood disturbance continues for at least 2 years in adults and 1 year in children. So this is where you have a prolonged mood disturbance for 2 years in adults and 1 year in children. Also, we have what we call premenstrual dysphoric disorder. Premenstrual dysphoric disorder begins sometime following ovulation and remits within a few days of menses and has a marked impact on functioning. Next type is substance medication induced depressive disorder. And so this type of depressive disorder is based on, probably onset based on substance or medication induced. Next one is depressive disorder due to another medical condition. So the person might be experiencing the symptoms of depressive disorder due to a medical condition. It could be the fact that maybe for some people when they experience other medical conditions, for example, cancer, it might be they might experience comorbidity with depressive disorder. Other specified depressive disorder. And then we have unspecified depressive disorder. These are disorders where, it does not relate to any of the specific categories. So let's talk about depression, or which is what we're going to be talking about in this lecture. Depression, major depressive disorder, as we saw earlier, it could be classified as clinical depression or major depressive episode. And so according to the National Institute of Mental Health, depression is a common but serious mood disorder. It causes severe symptoms that affect how we feel, think, and handle daily activities such as sleeping, eating, or working. So again, depression is a serious mood disorder. And when we're talking about depression, we're talking about major depressive disorder. To be diagnosed with depression, as was said earlier, the symptoms must be present for at least 2 weeks. For some individuals, major depression can result in severe impairments that interfere with or limit one's ability to carry out major life activities. So again, depression can limit a person's ability to carry out major life activities, and it can cause, severe impairments. It severely limits psychological functioning and diminishes quality of life. And so as we work with patients and family members and also our team members, it's very good that we bear these things in mind so that we can journey with them appropriately. As we can see, the past year prevalence of major depressive disorder among US adults, and this is a 2020 data set, taken from SAMHSA. And we can see here that 21 million individuals diagnosed in the US with depressive episode or major depression. And so we can see that's 8.4% of the adult population and 10.5% of the female population and 6.2% of the male population. Also, we see that the 18 to 25 age group has the greater burden with 17%, followed by 26 through 49 age group 9%. And also we see that 2 or more races again carrying the bulk of the burden with 15.9%, followed by whites with 9.5% of that population. So in 2020, an estimated 66% of US adults age 18 or older with major depressive episode received treatment in the past year. So 66%, so that's about 2/3 of the population with depression, or 2/3 of the 21 million. So again, we have 1 in 3 individuals with major depressive disorder, major depressive episode going without treatment. Among those individuals with major depressive episode with severe impairment, an estimated 71% received treatment in the past year. So again, 7 out of 10 with severe impairment, those who are diagnosed with major depressive disorder episode, only 7 out of 10 receiving treatment. And so again, we see that 3 out of 10 going without treatment in the past year. Past year prevalence of major depressive episode among US adolescents, 2020 data right here. And that is, we can see that 17% of that population, those who are between the ages of 12 through 17, and that accounts for 4.1 million adolescents. And we see that females again carrying the bulk of the burden, 25.2%. So 1 in every 4 females of a depressive disorder or a major depressive disorder or episode. And we see that males 9.2%, so it's about 1 in 10, but 1 in 4 for females. We see that the 16 to 17 age group, 21.9% carrying the bulk of the burden, and 2 or more races again carrying the bulk of the burden with 29.9%, almost 3 in 10. In 2020, an estimated 2.9 million adolescents aged 12 to 17 in the United States had at least 1 major depressive episode with severe impairment in the past year. So 2.9 million. This number represents 12% of the US population age 12 to 17. So again, of the 17%, we see that 12% experience severe impairment, those who are diagnosed with major depressive episode or major depressive disorder. In 2020, an estimated 1.6% of the US adolescents with major depressive disorder received treatment in the past year. So again, only 41.6%. So that simply means that only 4 out of 10 are receiving treatment. So 6 out of 10 not receiving treatment. And that is major depressive episode, regardless of whether the impairment is severe or, moderate or mild. Depression is a common illness worldwide, with an estimated 3.8% of the population affected. So again, 3.8% of the worldwide population affected by depression, including 5% among adults. So again, the worldwide population, 3.8%, among the population, but adults, it's 5% and 5.7% among adults older than 60 years. So those who are older than 60 years, it jumps up to 5.7 of that population. Of the adult population, it's 5%, and of the global population is 3.8%. Approximately 280 million people in the world have depression. And when we're talking about depression, we're talking about clinical depression or major depressive disorder or major depressive episode. Depression is a leading cause of disability worldwide and is a major contributor to the overall global burden of disease. So it's a main cause of disability worldwide. And so as we work with patients and their family members and our team members, and even for ourselves, it's very important that we understand, the symptoms that we can, be able to walk with our patients and their families and being able to refer them to appropriate treatment. So let's talk about the symptoms of depression. So the first symptom, based on the National Institute of Mental Health and the Diagnostic and Statistical Manual of Mental Disorders, is persistent sadness, anxious or empty mood. So persistent sadness, anxious or empty mood. So the person is persistently sad, or is, that sadness lingers. Next one is feelings of hopelessness or pessimism. So the person does not see, that their future can be better than their present. And so again, there is this sense of hopelessness. Irritability. So the person is irritable. Next one is feelings of guilt, worthlessness or helplessness. So the person, feels helpless, doesn't feel like, they are in control of what's going on. Next one is loss of interest or pleasure in hobbies and activities. So things that you used to previously enjoy, you find yourself that you're losing interest or pleasure in those things. Next one is decreased energy or fatigue. So the person has had a decreased or significant drop in their energy level, and they experience fatigue. So fatigue or loss of energy nearly every day. So this again affects the person energy, and the person feels fatigue. Next one is moving or talking more slowly. So the person, movement is sluggish, and they're talking slower than they used to. Next is feeling restless or having trouble sitting still. So the person is somewhat fidgety, and so again, feeling restless or having trouble sitting still. Next one, difficulty concentrating, remembering, or making decisions. So again, the person is having trouble concentrating, remembering, or making decisions. Next is difficulty sleeping, early morning awakening, or oversleeping. So again, the person probably having a hard time falling asleep, or the person sleeps a lot and are having trouble waking up in the morning. Appetite, and or weight changes, so decrease or increase in appetite nearly every day. So for example, the person has no desire to eat, or the desire is very low in terms of eat, or have no desire to eat, or the desire to eat has decreased, and or that desire to eat has increased in the person's appetite. Also, significant weight loss when not dieting or weight gain. So the person has experienced significant weight loss and the person is not dieting, or the person has gained a significant amount of weight. Next one is thoughts of death or suicide attempts. So the person is thinking about death or suicide, or the person has attempted suicide. Aches or pains, headaches, cramps, or digestive problems without a clear physical cause. So there is no clear physical cause of those digestive pains, or the aches or pains or headache. Aches or pains, and what we do know is that and it's not related to any medication you're probably taking or anything like that. And these aches and pains also, they do not ease with treatment. So even if you were to take something for these aches and pain, they won't go away, because it's related to clinical depression or major depressive disorder. So let's talk about some risk factors for major depressive disorder or depression. One is personal or family history of depression. So if you have a family history of depression, you're more likely to become depressed. Decreased or increase in appetite nearly every day. Next one is major life changes. So if you experience major life changes, trauma or stress, for example, a person can, become clinically depressed. For example, if they experience major life changes, like, for example, a person's father or mother immediately just vanish from that person's life, or it could be that the person probably experienced, a traumatic death of a loved one or any such situation. Or it could be also that the person has been diagnosed with a severe illness, and as a result, the person has become depressed. Certain physical illnesses and medication. So certain physical illnesses can cause an individual to become depressed or clinically depressed, and also medications as well can cause that as well. So let's talk about some strategies for mood improvement. So some strategies for mood improvement. You can try to be active and exercise, because as was said in an earlier lecture, that exercise has a way of improving mood, because it releases good hormones such as serotonin and dopamine, and the happy hormone as well. So if we spend and get 30 to 60 minutes of exercise every day, that can significantly improve our mood, or improve the mood of our patients and their family members, as well as our team members. Next is set realistic goals for yourself. A lot of times people experience significant stress because the goals that they have in life are not realistic. And so setting realistic goals for oneself can help to reduce a person's stress, and as a result being able to experience a more balanced mood or a better mood. Spend time with other people and confide in a trusted friend or relative. Spending time with other people, definitely you get that social aspect going and you get support. And if there are issues, it's important, if you are experiencing significant stress, it's important that you confide in a trusted friend or relative, or that we encourage our patients, their family members, and our associates, to spend time with those significant individuals in their lives, or those individuals that they can find support, are those individuals that support them, and also find somebody they can confide in to talk about the stress or what is affecting them. Try not to isolate yourself and let others help you. And so it's important, to resist the pull of isolation, because generally when people are clinically depressed, they try to isolate, but try not to isolate, and also let others help you. And so it's okay to seek help from others. And so letting our patients know that, letting our team members know that is important, as we as chaplains support our patients and support our team members as well. Expect your mood to improve gradually, not immediately. So expecting, the mood to improve gradually and not immediately can be really helpful, because if you're expecting it to improve immediately, that can create frustration or even further frustration. And so it's important that we're realistic in that expect the mood to improve gradually. So, letting our patients and our team members know that, that can be really helpful. Another thing is postpone important decisions. Postpone important decisions. So important decisions such as getting married or divorce or changing jobs until you feel better. And so letting team members know, our patients, our families, or even for ourselves, that we're going to postpone those important decisions, like buying a house, decisions with others who discuss decisions with others who know you well and have a more objective view of your situation. So getting another person's perspective on, those decisions can really help. So for example, selling a home, buying a home, if you're experiencing clinical depression, or if, team members, it's important not to make any significant or major decisions during this time. It's good to postpone those important decisions until you feel better. Next is get adequate sunshine. Sunshine is very important to our mood. The sunshine can just change a person's mood. And so depression generally is that we want to isolate. We want to, stay in the dark, stay by ourselves, but going out and getting sunshine can be really helpful. Vitamin D can really helpful, and the sunshine can really cheer you up. So getting adequate sunshine is also very good. So we can also, share this with our patients, their family members, and also our team members as we support them. Continue to educate yourself about depression. So having knowledge about depression can be very helpful, because you know what to expect and what not to expect. And so again, just continue to educate yourself about depression, letting patients know that, it's good for them to know what's going on and to know how this mental illness impacts them. And so again, just being educated and knowing what are the symptoms and how to respond, and some of the things that they can use can be very helpful to help them to cope. The Bible says in So Proverbs rather 13 and verse 12. Delayed hope makes the heart heal, but fulfilled longing is a tree of life. So delayed hope makes the heart ill, but fulfilled longing is a tree of life. So when hope is delayed or deferred, or when hope is not fulfilled, the heart becomes sick. And one of that might be, depression. But fulfilled longing or fulfilled desire is a tree of life. And so thanks again for joining today this pre-recorded lecture. I hope this information will be helpful in your clinical practice as you support patients, support family members, and as you support your team members, and also that it will be helpful for your personal use as well. And thanks again, and I look forward to see you in our next class.